We begin a week-long series this afternoon on Live at 4, honoring those on the front lines in the fight against COVID.
Every nurse in our community went above and beyond their call for duty this year to help others. And Madison Magazine is highlighting the top nurses providing care to those in need in a cover story called The Lionhearts, featuring nurses nominated by their peers, healthcare leaders, and community members, recognizing winners in 3 categories of innovation, practice, and leadership. We begin with one of the winners in the Innovation Award. Here's our Chris Stanford.
Defined as a new idea, method, or device. The high stakes of the pandemic have inspired some to rise to take on unprecedented challenges. That's certainly true for the 2 accomplished women you're about to meet. They pivoted on a dime, essentially putting their professional lives on hold because they had an idea. They learned new methods, and they knew the devices that would make a difference. It may not look like much, but the work happening in this trailer is quite incredible. It's here 2 women built a bridge between 2 groups of people that were separated by the dangers of COVID-19.
There was a problem I knew how to solve.
The problem was at Dane County's homeless shelters. When the pandemic was taking off, shelters needed nurses to screen their guests. The alternatives, another night on the streets or risk spreading the virus. That's where the bridge comes in. Let's call Bree Laughlin and Tracy Zvenich the architects. With nearly 4 decades of nursing between these friends, they refocused their experience and started Nurse Disrupted. The technological link they created connects nurses and guests at local shelters.
I knew how to do it with technology and nursing, and I couldn't think at that point of not doing it when I could see such a clear path and solution.
Their idea was to take the complexity out of the technology so nurses could screen patients through an iPad.
At the shelter, there's a tablet on a stick at the location. You touch the tablet, on the other end is our nurse or nursing student who's ready to observe, educate, and screen.
Though simple, it worked.
Our COVID-19 screening program have helped the shelters remain outbreak-free for over 6 months into this pandemic. They've done a great job with the safety precautions and screening each and every shelter guest every day as they come into shelter.
Bree and Tracy made another connection, too. Nursing students were having a tough time finding opportunities to get hands-on experience. Nurse Disrupted bridged that gap as well.
We have been able to collaborate with 4 schools of nursing in Wisconsin and supported over 550 nursing student hours. At the beginning of the pandemic, schools of nursing saw clinical site closures or reduction in the hours that they were allowed to be on site. So we have been serving as a virtual clinical site for schools of nursing and the nursing students to be able to get the hours that they need for graduation requirements.
Like any good bridge, Bree and Tracy's now has a solid foundation, and with enough support, can solve other problems as well.
Our populations in the homeless shelters, they had chronic disease and mental health crisis issues well before this pandemic. Now that we have them wired with the technology and the pipeline for nursing and nursing students, we have a real opportunity to deliver this care post-pandemic.
So far, Nurse Disrupted has performed more than 8,000 screenings. Congratulations, ladies. Keep up the good work. Chris Stanford, News 3 Now.
Congratulations indeed. A News 3 Now special presentation on all of the winners and nearly 60 nominees will be rebroadcast Christmas Day at 5 o'clock.